That's
Very,
weird. Okay. What about now?
it's better. It was
Okay.
coming in and out, but it's fine.
Okay. Cool. All right. I record my audio separate. So if you are ready, I'm going to hit record in 3, 2, 1. Hi, everyone. Welcome to Sandy K Nutrition, Health and Lifestyle Queen. Today with me, my special guest is Dr. Joon Lee, and she's the founder and medical director of SeeBeyond Medicine, a next generation medical practice offering uniquely integrated and comprehensive personalized care. At the foundation of SeeBeyond's process is discovery, of course, an initial analysis encompassing every element of clinical data, including genetics, blood, urine, and stool, as well as holistic input. Following this diagnostic testing, a personalized treatment plan is created with the full support of the SeeBeyond team. Imbalances and root causes of symptoms and disease are uncovered and treated through a wide variety of options, including IV therapy, detoxification, hormone replacement therapy, and regenerative medicine with the support of board-certified doctors specializing in functional medicine, integrative medicine, and obesity medicine. And today, Dr. Lee and myself are going to break down metabolic syndrome. I think that this is a great topic because so many hear metabolic syndrome, but don't really understand what it is. Like, what are the signs? What are the symptoms? What does metabolic syndrome even mean? Does it just mean that my metabolism is broken? Well, Dr. Lee and myself are going to break this down for you today. So, with that, welcome, Dr. Lee.
Hey, thanks for having me. Let's rock and roll.
Yeah, let's get into it. I mean, I have a lot of MDs here on my show,
Mhm.
but a lot of the MDs that I have on my show move to functional and integrative medicine. So I
Right.
have to ask you why. What made you take that turn to this area?
There's definitely limitations in conventional medicine. I definitely had a personal journey that made me move into functional medicine, which is probably similar stories out there where your own personal health come to an end with conventional medicine, and you're like, oh, this is what I learned, but it's limited. Now what do I do? So I immigrated to America in 2000. And in just 7 years of eating standard American food, which standard American diet actually abbreviates to SAD diet, standard
Yeah.
American diet, SAD diet, which was a lot of pizza, a lot of pasta, a lot of bread from Asian food. I migrated and then into a very much a Western diet, which resulted in 20 pounds weight gain and a gallbladder stone and a gallbladder polyp. So I was teaching at Albert Einstein back then. I was an assistant professor teaching medical students and residents. And I resorted to my colleagues saying, hey, like I have gallbladder pain, gallbladder stones, gallbladder polyps. What do I do with this? And everybody said, surgery, including my husband, who is a doctor. Everyone around me was surgery. That's your only option. So I did it. And then once I did it, I had a good 6 weeks of recovery where I finally had time to really delve into why did this happen to me? How could I have fixed it without surgery? Because I was really sad that I lost my gallbladder.
Yeah, yeah.
I mean, gallbladder is an organ. You can live without it, but I had to go in there and take out an organ. I said to myself, this just cannot be the answer, surgery. Like that's so it's such a simple answer. And maybe that is the way to go, but it was not the way to go for me. So once I self-reflected, I was like, I've been eating a lot of crap.
Yeah.
I haven't been eating my whole sort of nutrition of vegetables and grains and fibers and fruits and like all the rainbow colored diet that I used to have really turned into a very much a wheat-based, gluten-filled processed food was really why I got this disease, was what I landed in. And I went on a self sort of improvement journey as well as a self discovery journey where I found nutrition and I found micronutrients that are helpful in doing liver detox, gallbladder flushes, herbals like teas. And I was like, wow, like this has never been taught to me, nor have I taught my medical students. And that whole journey of 6 weeks really profoundly changed me in 2007. While I still was deeply rooted in conventional medicine and evidence-based medicine, and I believed in the literature and the evidence, I was like, there's something more to it where just by changing lifestyle, just by eating right, you could actually heal chronic illnesses. And then that took another like a year or two, and a private practice fell on my lap that the practitioner was actually already doing functional medicine, and I took it, and then I opened up my practice, and rest is history.
Well, I will say often it is our experience that fuels our passion, right?
Totally.
And yeah, and I actually know, including my husband, a few people who have lost their gallbladders. And, you know, I see what he deals with. So it's definitely a journey for sure.
Yeah.
Right. So I guess we can, now that we know your background, let's get right into it. What is metabolic syndrome?
Okay, so a lot of people feel metabolic syndrome equals obesity or being fat, but that's not it. Only 30% of metabolic syndrome patients are obese. A lot of it has to do with sugar. So I'm going to talk a lot about sugar, but it's defined, the definition of metabolic syndrome is 5 categories. One, central obesity. For men, it's over 40 inches of waist. For women, it's 35 inches. Sugar, fasting sugar, greater than 100, blood pressure, greater than 130/85, cholesterol, there's 2 titers in cholesterol that you have to be mindful of. One is triglyceride, which essentially is cumulative sugar, greater than 150, and then HDL, which is almost like a genetic imprint that you're born with, that essential fatty acid metabolism is very hard to change, but high density lipoprotein, high needs to be high. So that's how I remembered in medical school. HDL in men needs to be greater than 40, and in women needs to be greater than 50 for it to be cardioprotective. So when it's lower than 40 in men and lower than 50 in women, we call that one risk factor for metabolic syndrome. So there's 5 categories: waist circumference, sugar, triglyceride, HDL, and then what was the last one? Blood pressure, greater than 130/85.
Yeah. And, then you can even throw in a few other things like the waist to hip ratio. I think
Correct.
that's a really interesting one because, there definitely are, and you don't necessarily have to have all of these components,
Correct. Yeah.
right?
Mhm.
Like you can have, but what is it normally categorized? Isn't it 3 or more?
Yep, 3 or more. You're absolutely correct. And I love it that you brought up the waist to hip ratio, because especially in women, it is when we lose that waist to hip ratio, small waist, big hip, is when we really like get into the risk factors of like metabolic syndrome, which happens to be usually around your perimenopausal period when you start losing your estrogen. So I love it that you brought that up.
Yeah, because I mean, I've seen so many women, they reach around 50 and they're like, oh my God, I lost my waist. Where did it go? And that actually happened to me.
Oh,
And oh yeah.
you're
Oh
not
yeah.
even 40 yet. No way, Sandy.
Oh my God. I'm 53, my dear.
No,
Yeah.
you look amazing. That's great.
Well, thank you. But I will say what happened, and it's a little bit, it's humbling,
Oh,
right? When it happens to you and you're a nutritionist
mm,
and you're like, okay, I do have some signs. So I had the expanding waist.
mm.
But for me, I always give myself a little bit of leniency because I also don't have a thyroid. So it's like I'm going through menopause and it's like I also have that against me with the thyroid aspect because it's like I'm always running uphill. Does
Right.
that make sense? Like never on even without the thyroid.
Totally.
So, okay. So let's just say I am a 50-year-old woman and I'm noticing my waist start to expand. What do I do? What do I ask? Where
Well,
do I go from there?
well, functional medicine is always about why. So I guess we're going to go from why. So
Yeah.
why is your waist expanding? So, um, that's metabolic syndrome kicking in, but, I always sort of like to make it simplified. So I always say, I make it easy for people to understand. So I want to say three S's, meaning sugar, stress, sex. So we'll break it down. Okay.
Okay. Yeah.
Sugar is like, um, you know, all the sugary drinks that we drink, that's not water, all the yogurt, all the juices, all the chocolate bars, everything. At some point, there's a cumulative tipping point, right?
Yeah.
Sugar really has to go out of our diet, but it's so infested everywhere that we end up eating it. So sugar is one, and then stress. Around 45 to 55, there's a lot of life cycle changes that women go through. We may become empty nesters. Our marriage might not be the same as before. There may be a change in partner. They may be relocation, or they may be change in career. You finally found yourself and you didn't want to do the things that you used to do anymore. So there's a lot of stress that comes right around that age. You're taking care of your parents. You're also taking care of
Yes.
children, and you're running the household, and you have to do everything, and your husband or your spouse says they're helping, but they're merely doing one of your checklists, and they're like, look at me, I did that. And they want, rewards for that. And you're just doing a lot. So stress around that age is really pretty high, and you're overburdened by all these things that you need to do. I bet there's a lot of women listeners right now who's saying, yeah, that's me. I'm doing all that. I'm juggling work. I'm juggling like family, all of that. It's very hard. So stress is a big factor. And then when you have a lot of stress, guess what you lose? You lose your sleep. And you're just
Mm,
not sleeping as well anymore. But that has to also do with your biological and physiological change of your progesterone dropping, right? So
yeah.
progesterone makes you feel stable. Progesterone makes you feel nurturing and all of that. But as you lose your progesterone, which is the first female hormone that goes down, you lose your sleep. You're not falling asleep as well. You're not staying asleep as well. You're waking up with your stress factors. So when you don't sleep well, then your estrogen drops as well. And estrogen is really what makes female. It makes us diva, right? It makes us
Yeah.
feminine. It makes us have that waist to hip ratio that's like perfect. It makes us have good skin and good hair and all of that. You start losing estrogen, then you start losing your insulin sensitivity. So it goes right back to sugar, right? So we went
Yeah.
sugar, stress, and then we went sugar, stress, and sex hormones. And that sex hormone, loss of sex hormone, goes right back into insulin resistance, which makes your metabolic syndrome risk go up as we age.
Yeah. Let's get into insulin because I think it's important to talk about what insulin is because, you and I know it's a hormone and you want to be insulin sensitive,
Right?
right?
Correct.
But we lose that sensitivity when all those other things kind of fall by the wayside. So
Right.
let's talk about, okay, you kind of said it there, right there with sugar. We need to cut back. And I'm going to say this too. I have to say, I say this all the time. All those Starbucks that you're downing every day. Listen, I got a teenage daughter and she rolls her eyes every time I say it, but I'm like, I once calculated that one of her Starbucks drinks, one was double what a Coke is. And I remember, I'm a 1970 baby, right? So I remember Coke was the poison back then. So
Right.
imagine that one Starbucks regular fancy drink is double what a Coke is.
So I couldn't agree with you more, actually. I'm a
Yeah.
Starbucks hater. And I'm sorry to go online and say this, but all my
Mhm.
staff, all my young adult staff knows this. When they actually order Starbucks, I cringe because not only it's a waste of money, it's a lot of sugar bomb. It
Totally.
doesn't even taste that good.
No, you know,
Filled, but it's like such a waste, and it's so filled with sugar. It's so evil. I feel like their logo's evil too. I don't know. I hate it.
I have to say I align with you, and I will have a Starbucks once a week. But the Starbucks that I have is a matcha cold brew with no sugar. Because if
Right.
you don't specifically say, and you know, this is a little bit of a sidebar, everyone who's listening, but if you don't specific, like for example, the matcha, it automatically comes with some vanilla syrup, blah, blah, blah. You have to very specifically say no sugar, and
Keeps
then
it
you're going to get
clean,
it. Yeah,
right? Yeah,
to
no, I
keep it
totally get
clean.
it.
So there is a clean way to have a Starbucks, but I agree with you on the cost. Listen, for those people who say they can't afford, um, s- you know, integrative medicine, functional medicine, holistic nutritionists, all of that stuff, but they're downing, you know, $6 drinks every day from Starbucks. There's the whole money aspect. Okay, I know that was a sidebar, but you and I seem to be so aligned in this. Okay.
I'm gonna have to actually give them some credit where it's due. I love the notion of community. So they were brilliant in putting Starbucks with community. That's why
Yeah.
people go for that community. And community is a really big factor in longevity and health. So I give them that, but I want to give you also replacement. If you cut out Starbucks, go to Dunkin' Donuts and get a black coffee. Like there's
Yeah.
nothing wrong with that. And I'm drinking a hibiscus tea. I don't know if you can see the end of it,
Yeah.
but
Yeah.
I just spilled some. Hibiscus tea, I love. It's a great detoxification tea. It's bright red. I don't know if you're into like Chinese medicine, but anything bright red, raspberry, beets, hibiscus tea, all of those are good detoxification as well as good energy source.
Yes.
Love all of those. And then like matcha, I'm a big fan of matcha. ECGC,
Yeah.
great antioxidant, great anti-cancerous. Why wouldn't you do that instead of like
Yeah. I'm
sugar
with you.
filled like drink? I don't know. I'm completely
I'm
passionate
with
about
you on that. So obviously back to the whole insulin sensitivity. I mean, if you're downing a lot of sugar, um, the way I don't know what you think of this, but y- women women in this age category, it's almost like you're using up that hormone. I
yeah.
think of it, and when I'm explaining it to other women, I'm like, okay, think of insulin. Okay, glucose is saying, hello, insulin, can you come to my rescue? I've
Yeah.
eaten a lot of sugar, and it's like knocking on the door of insulin, and insulin's like, all right, I'm coming. And then they come and they lower that glucose in the blood. But then after a while, insulin gets tired and they're like, I'm not coming anymore.
Yeah.
Like I always use that analogy because I like to make it simple to explain when you're constantly tapping on those resources for your body that are designed just to do what it's meant to do, not have, 60 grams of sugar in one drink,
Yeah.
right?
Totally. So insulin is made, I'm going to put on a little bit of a doctor head here.
Yeah, yeah,
It's made in the pancreas by the beta cells to lower your sugar. So when glucose sugar comes in, then insulin goes up. If any food comes in, insulin goes up to lower your sugar. So your body has this beautiful mechanism of maintaining sugar the same all throughout, whether you have eaten or not, because pancreas also has a beta cell that produces glucagon, and glucagon knocks on the liver, which has stored your excess sugar when you ate too much, to release that sugar so that your sugar level is maintained, so that your brain can work, your muscle can work, and we can go on about our day and not get hypoglycemic during our sleep as well. So the beautiful balance of insulin and glucagon, we disrupt it by giving sugar, 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 sugar all throughout our day, and not even giving a chance for glucagon to ever come out because you have never not eaten throughout the day. So you really definitely want to have intervals in which that are sort of like routinely eating every 4 hours or having intermittent fasting so that your body has a way of balancing those two hormones out rather than you're just knocking on insulin all the time, right?
yes. Yeah. I mean, would you say, of all of the five things that you mentioned right at the start, would
Right.
you say the root of all of it might be Sugar?
We said it at the same time. Yeah, root of all of it is sugar, and sugar is evil. And you really want to be doing
Mm.
a lot more keto, a lot more plant-based fat. When you look at your plate, you really want to see a rainbow of colors there: red, blue, green, orange. You don't want to be seeing like beige and white all the time. Anything
Yeah.
that's processed, that's made from the factory, try not to fill up your pantry. Try to fill up your refrigerator with things that are going to perish and die because they're alive. You eat live foods, you're going to live longer. You eat dead food, you're going to die soon.
No, it that totally makes sense. Now, I want to say one thing. You did say, beige foods.
Yes.
So I want everybody to know that don't think of sugar as just actually sugar. Even too much fruit
Yeah,
can pose a problem.
yeah, fructose. So when I talk about fruits, I love fruits. I mean, I'm guilty of that.
Mm.
That's my sugar source and that's my guilty treats. But you really definitely want to distinguish between high glycemic fruits and low glycemic fruits. Unfortunately, all the supermarket fruits that are cut up for fruit bowl, that's high glycemic fruits. Those are tropical fruits in the melon family: watermelon, cantaloupes, grapes, mango. Those are high glycemic fruits. Stay away from that. If you want fruits, stick with the low glycemic fruits, which are berries and maybe some rock fruits like apples and pears and peaches and prunes and plums, and maybe citruses like grapefruits and like lime and oranges and lemon. But really, berries are the best in terms of antioxidant sources. Stay away from your high glycemic fruits because those fructose are essentially sugar.
Hmm. Yeah, absolutely. And then, I have a ton, like, I mean, I don't even think we have enough time to get through all of the little tricks on how you can just eat to support your insulin and your glucose to be a healthy balance.
Yeah.
And, I'd love to hear some of your little, tips and tricks that you give to your patients.
Got it. So I had mentioned keto and I had mentioned, so one of the things, if you're really trying to lose weight and you're doing weight management, one of the first thing that we do with you is really analyze when you eat, how you eat, who you eat with, how many times you chew, because it's really not just what you eat, it's how you eat also that matters. And when you eat, that matters. So I do say follow your circadian rhythm. When you wake up, you should put food into your body within an hour and wake your sort of metabolism and your energy system up. And then I want you to keep feeding yourself every 3 to 4 hours, 3 to 4, in very small quantities. So if you're having a protein, I would say nothing bigger than a deck of card or your size of your mouse. If you're eating fat, nothing bigger than like a golf ball size. So avocado would be like quarter of an avocado kind of a thing. And really try to take away all the carb, but put it in a lot of greens because vegetables do have carb,
Yes.
more complex carb with a lot of fiber. And then
Mm.
you can have as much leafy green as possible, but try to feed yourself every 3 to 4 hours. When you start doing that and you eat like 3 to 4 or even 5 times a day, your metabolism changes from anabolic, putting on weight, to catabolic, burning calorie. So that's one strategy that I use, actually feeding yourself in very much small quantity that's keto based every 3 to 4 hours. So you're never hungry, but you're also never full. You stop around like 80% satiety. That's one strategy. Another strategy is restricting the calories by, I don't like restricting calories, by the way, but if we have to, we do it by intermittent fasting, in which you eat only 8 hours a day. So then you kind of sort of
The window, right?
that window of time.
Yeah. Yeah.
So everybody's different and everybody's life circumstance is different. Everybody's culture is different. So you have to be culturally sensitive and you have to be sensitive to their lifestyle. So if 8 hour eating works for you, go for it. Intermittent fasting has so many evidence on stem cell activation, diabetes going down. I love it. But if you're somebody who can't hold hunger and you have the capacity and the means to eat every 3 to 4 hours, I also like that because you're constantly feeding yourself and you're not letting go in a way that you feel hunger or deprived. So it really depends on who you are. But I love keto. I love green keto, especially eating a lot of vegetables with good grass-fed meat, with like good plant-based fat. Keto, sometimes people think it's like protein, 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 but it's actually plant-based fat, lots of fat, and then some protein with lots of veggies. So that's what I
Mm.
say.
Yeah, dirty keto, I remember that was a thing. I don't see it as much as I used to, but I'm like, please, people, don't go to McDonald's, wolf down a hamburger patty and call it keto. Uh,
I agree. Green keto is
yeah.
so much better, especially
Um,
gluten, we can
yeah,
eat our veggies.
I do think I like that you have different approaches depending on the client and what their issues are too, because, you know, I think the key is you want people to have a healthy metabolism,
Yeah.
right? And with everyone, there's going to be different reasons why it may not be healthy. And I never used to think that you could break your metabolism, but I actually challenge that now. I think that you can. I do think that you can.
You can train your metabolism. And I do think of our body as a terrain, right? We're all part of Earth. We're just one stardust,
Yeah.
all of these. So you can actually really train your body, and your body actually changes within like 2-3 weeks. But really, if you want like a more of a permanent change, it's over 90 days. So our approach is that 14-week discovery program is really an approach in which not only you discover your genetics, your metabolism, your microbiome, your neurotransmitter, your hormonal status, but it's really a way in which we change your life fundamentally. From wake up to what do you do after wake up? You train your bowel movement, you train what to eat, you train yourself to sleep. It's like what we did as mothers for our kids. We taught
Mm,
them what to
yeah.
eat, how to sleep, when to poop, how to poop. We actually do that process within the 14 weeks. We make sure that they poop every morning. We make sure
Yeah.
that you eat and nourish your body every 3 to 4 hours. We make sure that you sleep that 8 hours, but we base it on scientific data. We base it on your genetics. So you have a detoxification, single nucleotide polymorphism, like genetic mutation. We emphasize that and we educate you. You really have a detoxification problem. So if you have a CYP1A1 gene, you're a slow coffee metabolizer. Coffee is a no-no for you, which is me. So I don't drink coffee. I try not to, at least. So like if you have like a BRCA gene, which is a breast cancer risk, that whole estrogen or any xenoestrogen or meat that is not, grass-fed and like clean is a big risk factor for you. So by having those data points, you can really change your life because you got data and you got
Yeah.
empowered and you got educated and you have somebody who walks you through every step every week. So you change profoundly. If you look at our Google reviews under SeeBeyond Medicine, a lot of our Google reviews are, oh my gosh, you really changed my life. She taught
Yes.
me from scratch and she like, everything about me is different. That cell turnover, complete transformation happens over 90 days. Your A1C is 90 days. Your RBC turnover is 90 days. So in 90 days, you could get a lot done.
Yeah, absolutely. It's a synergistic approach. And I think that when you're starting to see these symptoms of metabolic syndrome, you have to take a synergistic approach because even for me, I know I carry some SNPs, so single nucleotide polymorphisms. You'll see that. I have a lot of little tricks as it relates to genetics with clients, but I do carry a couple of SNPs that would predisposition me to type 2 diabetes. So these are important things to learn,
Yeah.
right? Like everybody needs to learn this. So what is your risk? What do your parents have? My parents are pretty healthy, but I know my mom and I share a lot of the genetics that aren't that great. And so, she's now going to be 77
Nice.
and I've always grown up where we cook at home, Eastern European, pretty much Mediterranean. But with my mom, it's like I had to train her. And she's like, but fruit is healthy. And I'm like, yes, it is, but not a giant bowl of fruit every day at 3 o'clock without anything to shunt that spike, that glucose spike. right?
Totally true. Yeah.
So there's a lot that we can do. I mean, let's get into what are the risks. So we know high blood pressure, like we know what the signs are.
Mhm.
The risks are obviously heart disease,
Yeah.
type 2 diabetes.
Yeah.
There's a lot actually that goes along with this. Do you want to finish the list?
Yeah, no, totally. So, obviously diabetes, obviously heart attacks and strokes, right? That's just obvious, right? With blood pressure and whatnot. But there's actually fatty liver that turns into liver cirrhosis. You don't have to have hepatitis to get liver cirrhosis. Fatty liver long term turns into liver cirrhosis. And then cancers, especially colorectal cancer in men, are very much related to metabolic syndrome. And the age in which people get colorectal cancer is getting younger and younger. And it's completely from our drained terrain and our food, processed food, completely. And then the second thing, breast cancer in women, endometrial cancer in women, pancreatic cancer, ovarian cancer are all what I call metabolic cancers, right? So those metabolic cancers, did you even know that like our cancer antigen actually was first named carbohydrate antigen? It's
Well,
actually
cancer feeds on carbs, right?
right. So it was carbohydrate antigens, the cancer markers that we check in our blood. It just became cancer antigen, and we kind of like use the name like interchangeably, but sugar definitely feeds on cancer, and cancer risks are big with metabolic syndrome. And there's one other titer that you can check in your blood that I didn't mention in the beginning because it's not the definition, but if you have uric acid that's high and you have gout, that's a tail sign that you have metabolic syndrome. It's like one of those that didn't make the list, but it should have really made
Yeah.
the list. And then to just go back to your SNPs, just in case one of you guys actually check your genetics or has done 23andMe, I always say for like, especially menopausal women, you really want to know if you have at least 3 of those genes. I keep going back to 3 because I want to sort of hammer in the point that you can actually remember. One is ApoE4. So if you have ApoE4, you have a much greater chance of having dementia. And guess what fuels dementia? Sugar and metabolic syndrome, right? So if you have an ApoE4, you
And 3. And 3.
and 3, but more 4. But you really seriously need to be like, oh my gosh, sugar is my enemy. We just recently did a survey on 100 men and women over 65 with household income greater than 350,000. And they all sort of like had questions on longevity and what are they most fearful of as they age. And the 3 things that were most fearful of, the first one was loss of cognitive function.
Totally.
All fear that. And then second thing was loss of mobility. And then the third thing was a result of loss of cognition and mobility is loss of independence. You never want to be there. You want your lifespan to be 99. You want your health span to be 99 as well.
Yes.
You want to match those two. You want to be healthy as long as you live. I would rather die at 89 and be healthy until 89 than live that one, like 10 more years, miserable in bed, suffering. What's the point, right?
June, you know, somebody who I interviewed once, he's like, you know what? Let me just, at like 100, just fall off a cliff, hiking the Grand Canyon, or
Yeah,
like, but
totally.
it's true, right? Like you wanna enjoy your life right to the end. I'm so with you on that.
Right. So you definitely want to work towards that. So it was ApoE4, ApoE3 we talked about. The second one, I talked to everybody about it because it's such a simple solution. You want to know if you have a genetic mutation called MTHFR. So MTHFR looks like an abbreviation for motherfucker. I said it.
Yeah. Everyone calls it that, June.
Sorry, because
That's
it's a
okay.
motherfucker gene. And it's very common. It's very, very common. I have half of it from my father, I think. But it's a cardiovascular risk as well as like a little bit of anxiety risk. Like there's some risk associated with it. And just because you have the genetic doesn't mean you have to express it.
Yes.
That's genetics. But a good way to not express it is just taking methylated B vitamin. How easy is that? Take a methylated B vitamin in the morning and you will prevent I don't know, cardiac event to come in the end, you know? So
Yeah.
check your genetics and then take something accordingly so that you can beat it, right? Defy your DNA.
Yeah.
The third one that I say you should really know whether you have it or not is COMT, COMT. Talked about
Yes.
stress,
I
right?
was just talking about that yesterday.
Right. So COMT has two variants. Either you're a warrior, you fight, or you are a warrior, you just worry. So either way, you want to know which one you are. And there are stuff that you can do with it. COMT is super important because it's related to stress and sex hormones. So,
Yes.
you know, your stress resilience is different depending on which COMT variant that you have. And then your estrogen metabolism gets really mucked up when you have COMT. I'm getting a little casual here, but you really want to know, am I a warrior, or like, you know, you just want to distinguish that. And you want to get your sleep in order. You want to have more ground flax seeds in your diet. You want to drink matcha, not coffee. You want to figure all that out.
Yeah, I love that you mentioned CompT because I'm a CompT GG, and now we're
Oh,
getting really technical. So, according to my genetics, I should have ADHD and autism and all of the things, right? Because
apparently
I am this,
you
but I
clearly
can't.
don't.
But you know what though? I have learned to work with my genetics and really be able to hone in, but I have to work a little harder. But I love that you mentioned knowing your genetics because I always say, there's so many people who are like, oh, I don't want to know. I don't want to know. And I'm like, well, why would you want to bury your head in the sand and
Yeah.
just, right? Because the bottom line here, people, and this is an unfortunate thing, but as we age, we may not have seen any of these issues in our genetics when we're younger, but like you were saying, June, like they start to express as you get older. There's many reasons for that. Maybe we're not absorbing our B vitamins like we used to, where our digestion sucks,
Mhm.
or we have low HCl, so we're having other issues absorbing minerals. So we just need to be equipped
Right.
with the information. You know what I'm saying? And
I
then you could do something about it, right?
totally agree. You don't know what you don't know, right? So you really want to know what's going on with me on a genetic level, as well as like what's going on with me right now. Because, I love genetics because it makes me a fortune teller.
Yeah. Yeah.
But not just fortune telling, but fortune telling with solutions, right? And I
Totally.
love data of like blood, saliva, stool, urine, all of that. When you compile all those data, you can make a profound change in your biochemistry by nutrition, supplements, IVs. And when you make that profound change, guess what? It's not our willpower that changes our habits. It's actually our biochemistry that drives our behavior.
Mm,
By changing the nutrient with like supplements and IVs and whatnot, I can actually change your willpower, and
hmm.
your behavior will change accordingly because you feel better. You wake up refreshed, you're more motivated, your dopamine is up. So you're more likely to execute.
Yeah. Okay. So we covered a lot so far. I definitely need to go back. I think you said only 30% of people with metabolic syndrome have a weight issue.
Correct? Yeah.
So here's what's interesting. I do find this interesting is a lot of times I might see, middle-aged or older woman, even around 60. She does not look overweight,
Yeah.
right? Like you look at her arms, her legs, everything. She doesn't look overweight, but she's got that belly,
Totally. You don't even
right?
have to have the belly. I'm going to just stand up for a second because I do have a kind of a good hip to waist ratio.
Yeah, yeah.
Guess what I am? I'm skinny fat. I'm
You?
skinny fat. Yeah. And that is why I got the gallbladder disease, because it's really about your body composition.
Oh, I'm with you, girl.
It's like muscle to fat ratio. I have so much fat and not enough muscle. I might look fine, but I'm really not fine inside.
Interesting. So do you do weight training at all?
I just started, and it started
Oh,
with,
good.
like, the genetic discovery of I'm a sure shot for osteoporosis with like vitamin D absorption problems. So I just started like really heavy duty weight training like 3 times a week, and I'm going gung ho because I'm turning 50 next year.
Yeah.
And I'm like, I have really got to turn this around and beat
Yeah.
my genetics. So knowing your genetic is half the game. And then if you know it, do something about it so that you can beat it, right?
Yeah.
Skinny fat is one thing that I wanted to say. You might look fine, but go into a functional medicine practice or Equinox or whatever. I don't know what you guys have in Canada, but there are gyms equipped with InBody. You can even get a scale online that has body composition analysis.
I have
And
a great one.
yeah,
And
how much is muscle? You got
yeah.
to know that.
And it really does concern me, I will say, when women our age, because we're close to age. I'm older than you though.
Oh, you look great. I thought you were younger. You're so
No,
shiny. I was like, oh, she must be like 38.
no. Okay. So the one thing that always concerns me is when I hear, because I hear a lot of women talk about their weight and how they're so worried about their weight. Oh my God, I'm gaining weight. I'm gaining weight. The first thing I say to them is to get one of those scales that you talk about,
You're so right.
because it's number one. I quite frankly don't give a shit what you weigh. I
Yeah.
don't give a shit what you weigh. I actually don't even care so much about your BMI unless you're on the higher end of
Mhm.
overweight. I don't care what your BMI is, because it doesn't take into account your muscle and your bone and what's that body of yours composed of, right?
I totally agree. Like, my goal is to get to 50 pounds of muscle. That's how skinny fat I am. I really just want 50 pounds. That's all I'm asking for. But you guys got to know, everybody out there, how much is my muscle? Like, out of
Yeah.
140, 150, or 200 that I am, how much of that is muscle? You got to figure that.
Yes. Yes. So if you're listening, you've heard a few things from us. Number one, what's your waist to hip ratio? And that is it waist divided by hip or hip divided by waist? I forget what it is. All I know, I forget what it is, but it has to be less than 0.85, the ratio. Okay. You can look it up, people. There's a calculator online. Know what your waist to hip ratio is. Know if there's a change in your body, meaning you're noticing your midsection going a little bit bigger. If you have weight gain, if your blood pressure is going up, if your fasting glucose is high, right? And then we didn't even talk about HbA1c.
We
Like
talked about it.
we,
A1.
we did, we
We
did.
didn't. We can.
Well, let's talk to us about how important. This is totally my opinion. I'm not a doctor, but I think HbA1c is more important than fasting glucose, because if you eat good for a couple days and go, okay, I'm going to go do my blood work. I ate really well for the last couple days. Go and do it, and your fasting glucose will look beautiful, right?
Totally. So fasting glucose greater than 100 is metabolic syndrome. So that's not really that hard to achieve. But A1C, which is cumulative data point in your red blood cell of what you've been eating for the last 90 days, really gives you a sort of like a cell memory on your behavior, right? So you definitely want to know what that is. And you want to be lower than 5.7. So from 5.7 to 6.4-ish is what we call borderline diabetes, or like insulin resistance. After 6.4, you're diabetic, but you want to be, I say, less than 5.5. Even 5.6, I start being like, okay, be careful with your sugar intake. Sugar is like cocaine. Cut it off. Once you start eating it, you can't really stop. You just have to cut it off. It's like abstinence is the best way to go about cocaine, alcohol, sugar.
I'm with you.
I take it that seriously. So, 5.7 is really absolutely the last mark that you want to be at. So you want to be 5.2, 5.4, 5.5, even 4.7. I don't care. But, you don't want it greater than 5.7. And you want to know what your A1C is every 90 days. We talked about
Yes.
over. So RBC turns over every 90 days, RBC, red blood cell. So you want to be checking your blood work every 3 months. If that's too hard, at least twice a year, to kind of figure out where your A1C is at.
Yeah, I love it. because so last year, for the first time ever in my life, I actually had an elevated HbA1c. I got up to 6.1.
No, you know what? But you know what? I have to give you some leeway because Sandy, you don't have a thyroid. So thyroid not being there, thyroid is your fight hormone. So if you don't have a thyroid, your sugar control is much harder. It's harder than other people, and you're bound to have your cholesterol go up. The more
Yes.
sluggish the thyroid is, the easier it is for your cholesterol to go up. So you have an uphill battle there. You
Yeah.
really have your TSH lower than 1. Having TSH lower than 1 has evidence, scientific evidence that says that suppresses all types of cancer. So if you have hypothyroidism, you're at a risk of breast cancer, you're at a risk of cardiovascular disease, and you want to suppress your TSH under 1.
Yeah.
So
Yeah.
big one.
I've had definitely some of these ups and downs, and I think I'm not alone. Even though I don't have a thyroid, I'm not alone in this. A lot of women around our age group start to have these ups and downs. But this is why knowledge is power. And, I always say work with a practitioner who understands this. Ask, and, here, okay, most of my listeners are American, like 80% of my listeners are American. So, in Canada, there's a socialized medical system. And sometimes Canadians have a really hard time to get their doctors to run the blood work
Hmm.
because doctors in Canada get audited. I'm not sure if I'm supposed to say that, but I'm going to say that. Anyway, this is the problem, right, with socialized healthcare. So you may have a challenge, but you need to know that there are always options. You can always work with a functional medicine doctor. Save that Starbucks money to work with somebody who can help coach you through this or guide you through this. Because now I haven't checked it lately, but I managed to go from a 6.1 last September down to a 5.7 in February. Yeah.
That's a great job. Excellent.
So I sat there in that higher HbA1c for a very short time.
Yeah.
I knew something's going on. And so I got to check it again because it's about that time. So I will check it again. But all I'm saying is there are ways that you can do this. Don't ever let your GP tell you, oh, you're pre-diabetic, you need to go on medication. No, you don't.
Hmm.
You don't. I mean, you might have to. I'm not like, I live on medication. I have no choice. I have no thyroid, right? But I'm just saying, if you can do things with diet, nutrition, work with your genetics, therapeutic grade supplements, there's so many things that you have control over. And I like to tell everyone that they do have that.
I couldn't agree with you more. So a couple of things I want to hit on. Just
Yeah.
because you're in Canada doesn't mean you cannot work with like an American functional medicine practitioner, because we actually have some Canadians in our panel. So we
Beautiful.
have like Swedish from Sweden, we have Dominican Republican, we have South Africans. So we are kind of international, and a lot of our test kits, believe it or not, are saliva, urine, stool boxes, or breath tests even, that we can ship over and you guys can ship it back. So,
Beautiful.
don't let the distance be your barrier is one thing that I wanted to say, because we do have international clients as well as within America, like West Coast, Midwest, all of those clients actually do come to me. And in our survey of like trying to figure out who our audiences are, and 4.5 out of 10 people didn't mind telemedicine and traveling a distance to see a good practitioner. So good practitioner that actually gel in well with you and have good chemistry with you, who's a good listener, who is going to
Yes.
see you through your journey and is committed, is worth $1,000,000. Because
I'm with you.
doctors are so burnt out, socialized or not socialized in the insurance-based system, even here in New York, that we're half listening at times. We're like, we get 10 minutes. Like, what are we going to get out of 10, 15 minutes visit?
Yeah.
You want that functional medicine practitioner who's going to listen to you over 60 minutes, 90 minutes, really see you for who you are and listen to your story fully, and then see you through your journey so that you actually get out on the other side, right? And you're not stuck in the same predicament over and over and over again. You go to a doctor every 3 months, every 6 months, you're still diabetic, there's a problem. There's got to be a way to reverse that. If you're still going to a doctor and your cholesterol is not going down and you're just merely taking a pharmaceutical band-aid of statin, and there's no talks about changing your diet or sleep patterns or how you can de-stress and downshift and all of that, then it's time for you to change your practitioner and get a little bit more root cause and fundamental about the whole thing.
I couldn't agree with you more on that, obviously, because I always feel like the other thing I will say is it's called proactive health, right? Before, like, it's always easier to address the symptoms versus the disease,
Correct.
right? So you have time. And if you start to notice some of these symptoms, you got time, people.
Right. And always like test, assess, and then don't guess. Don't be just guessing. Maybe I have this. Maybe I have that. I wonder if I have that. Why do I feel so tired? Why do I wake up so tired? Maybe I have Lyme. Maybe I have, I don't know, mono, but you're guessing. You want to test and assess accurately.
I agree. I agree. Now, I can't finish off this conversation. We're coming close to an hour without asking, what are some of your favorite supplements that you use to help with metabolism?
So we have protocol, something called My Weight, which is B vitamin based. We talked about MTHFR, but it's also a lot of our eating. A lot of the listeners are going to identify with this, is emotional. So I started my period this morning and I was stressed out about this podcast. I ate chocolate. I don't eat chocolate. My husband was like, what's wrong with you? And I was like, I have a podcast that I got to go on. And I was like, where's my dark chocolate? I was looking for it, right? So, really you want to be mindful of what you're eating and whatnot, but you also want to drive it from the chemical point of view. My hormones shifted with my period, right? That was what's making my behavior change. So My Weight is a great supplement you can get on SeeBeyondShop.com. Berberine you can get anywhere, honestly. Berberine is a great sugar lowering supplement that also helps with your joint pain. So it's going to help you to move a little bit more and become more active and sweat a little more and exercise a little more because your pain will be gone. Not only will your sugar be gone, your pain will go down. Chromium has a lot of evidence on how it lowers sugar. We use something called leptin balance, which actually we didn't touch on it, but leptin is our fat hormone produced by our fat cells that controls our satiety. So I love that leptin balance. And for those of you who
What is the leptin balance that you said? What is it called?
It's called leptin balance. If you go to SeeBeyond Shop, it's all there. So SeeBeyondShop.com will have all these.
Okay.
It's one resource for you. And then like for those of you who have cholesterol problem and who are on statins, if you're on statins, please take an active CoQ10 to negate the fact that the statin drops your active CoQ10. That's ubiquinone or ubiquinol. If you don't want to be on statin because of your muscle aches or muscle pains or joint pains that you get from statin, you can check your genetics to see if statin is right for you. But if it's not right for you and you're having side effects, you might want to consider changing statin into red rice yeast. Obviously, lifestyle and like eating right comes first, but there is something called red rice yeast. That's yeast that's grown out of red rice that is very similar to statin, but less side effect. That is more of a natural product that you can take. I mean, I can go on and on and on, but like B vitamin, magnesium, vitamin D, fish oil is probably basic stuff that everybody should be on.
Yeah, I align with you on all of that. The interesting thing, I've actually, so I carry the SNP for myopathy from statin use.
Right.
And I know this, again, people, obviously, if this hasn't given you a clue to know what your genetics are, hello, go check your genetics. So I carry that SNP. And I also have, some issues, and going back to the whole last year situation, again, for the first time in my life, at that point, I also had high triglycerides and I had never had that in my life.
Yeah.
So that's also come down. So one thing I will say is that you have to take a synergistic approach
Mm.
no matter what you do. Like if you think, oh, I'm starting to show symptoms of metabolic syndrome, I'm going to take berberine and call it a day. I'll say right now, supplements, like, we're talking about supplements, but they'll only get you so far. You have to make a synergistic approach to your lifestyle. Like, I was 25 and smoking, and I was skinny girl and skinny fat girl. Like, I can't do that anymore. Right. I quit smoking so long ago, and I can't imagine myself as that person anymore. But, if you're 40 something and you've still got some of the habits of your 25-year-old self, maybe it's time to think about changing some of them.
Totally. And I have to say, sugar, avoid sugar, sweat, exercise, use all of your detoxification mechanism, not just pee, poop, and sweat. Like that's really important. Downshift your stress every day. So whether it's hot bath or meditation or prayer or
Yeah.
breathing, downshift your stress. And then sleep well. Like people sleep well. Sleep is where you restore and
Yeah.
repair. And if you don't sleep well, you're not going to lose a pound.
Yeah, right. Because, okay, we have time to get into this really quickly. When you don't sleep well, and listen, you are a doctor, so you're going to speak in more of a clinical sense, but I'm going to say ghrelin, which is that hormone. I call it, so that people remember ghrelin, gremlins, right? Hungry. Anybody seen the movie Gremlins? Your ghrelin goes up. That's your hunger hormone when you don't sleep well. And I know that happens with me. If I have a late night and, which is very rare for me, by the way, I'm usually in bed by 10 o'clock every night. And if I don't do that and I have a really poor night's sleep or less sleep, did you notice that you're hungrier the next day?
Totally. And you end up eating at midnight. That's the worst.
Totally.
Wake up all swollen.
Yes. Listen, I call myself the balance queen. I believe in a very vibrant, healthy, balanced life. But, I'm kind of like with things like staying up late, it's like that whole 80-20 rule,
Yeah,
you
totally.
know, even more so like 90-10, like 90% of the time I go to bed by 10 o'clock and 10% I don't. And it's
Yeah.
on very special occasions.
Yeah, that's very good one. I tell them why, like when we raised our children as mothers, you guys all remember by 8 o'clock, we we're like, go to sleep, because
Totally.
growth hormone gets produced at that time. It's really 9 to 2 a.m. 9 p.m. to 2 a.m. is where your restoration and repair and hormone production all happens. Growth hormone, estrogen, testosterone, you name it. That's why men get morning erections. And that's why women who are really tired at night and your husband wants to have sex and you're like, no, not now. But in the morning,
Yeah.
we're more likely to be like, okay, like, because we have restored, right? And our hormones a little bit higher in the morning. We're all driven by chemistry. It is not our willpower. That's something that I want to hone in. It's not your willpower. Just because you want to lose weight doesn't mean you lose weight. Just, it really is driven by biochemistry. It's biochemistry behind us. So sleeping from 9 p.m. to 2 a.m., even if it's like 11 to 2 a.m., get that 3 hours in, because that's when you get your hormones restored. And that's why you repair your system. That's why people who don't sleep get fibromyalgia and they're in pain, because their body hasn't repaired.
Yeah. And if you're a woman going through menopause, I'm going to say the struggle is real in the
Yeah.
sense of sleep. I don't want you to think, you're doing something bad or whatever because you can't sleep, because even like people like me, nutritionist, well, I mean, I'm if you look in the technical sense, I'm not in menopause yet because I had a period in December, but I'm like, it was mid-January, February, where I started to have issues. I could always fall asleep. That's never the issue. It's when you get the 3 a.m. wake up or the 2 a.m. wake up or the 4 a.m. wake up, and then you can't fall back asleep. And then your sleep is shortened. And so really work with a functional medicine doctor to see if you just maybe need to, like I've been on bioidentical progesterone since I was 48, but
Mm,
I recently added in estrogen and it's that whole synergy. It's
right.
a beautiful thing. My husband was like, "Oh my God, like how long did you sleep last night?" I think on the weekend, I slept 9.5 hours. And I wake up, I don't need the under eye concealer. I don't like, I feel so good. And
Yeah.
then it's like everything falls into place. I don't eat like shit. I feel good. I don't gain weight. It's like, so work with a doctor like yourself to get on the hormones if you need them. And I have an amazing doctor who she really follows the science. She follows the science that you don't necessarily need to go 1 year of extreme suffering with not sleeping and night sweats and all the stuff that tends to come with menopause, right? She's like, if you're having the symptoms, let's look at this.
So if you're suffering from sleep or lack of sleep, there's two tests that you should do. One is a neurotransmitter testing, because sleep at the end of the day is brain neurotransmitter driven. And then two is a Dutch test, which is hormone metabolite testing. And you touch based into it because you touched on it. I'm going to talk a little bit about brain neurotransmitters.
Sure.
Our brain neurotransmitters are divided into excitatory neurotransmitters and inhibitory neurotransmitters. They should be in balance. So if your inhibitory neurotransmitters are low, you're not going to sleep well. If your excitatory transmitters are really high and you're anxious, you're going to wake up at 3 a.m., 4 a.m. because your excitatory neurotransmitters has not been degraded out completely. Those happen to COMT genetic carriers, by the way. But at any rate, if you check your excitatory inhibitory neurotransmitters, and you know that GABA is depleted, take a GABA. If you know that your melatonin is depleted, take a melatonin. Instead of guessing and just taking melatonin or GABA or CBD oil just out of a guess, if you really knew your titer, you could do better in your sleep. So my favorite supplements for sleep is GABA, magnesium, melatonin, L-theanine, which crunches down your anxiety. And I have put it all together to create something called My Sleep. Again, you can find
Beautiful.
that on our shop, but My Sleep is so good that I have taken people off of Xanax and Ambien because
Beautiful.
all the inhibitory neurotransmitter all together. So it's pretty strong, even though it's a nutraceutical. So
Yeah.
it is a nutraceutical that competes with pharmaceutical, and it's all natural amino acids. So,
And non-addictive. So
oh,
yeah,
yeah.
I know. Like at one point I was taking L-theanine and I'm a big fan of microdosing with melatonin. I've been
Yeah.
doing that for over a decade. Over a decade. And when I say microdose, I am talking 0.25 milligrams, like 1/4, because that's enough just to get that excitatory. It doesn't make you pass out like a sleeping
Right.
pill, right? Like it's just, and I actually did a show on melatonin of how therapeutic it is. But again, I love your point of, testing it. And then, I'm sure you're going to talk about the Dutch test, right?
Yeah. So before we go there, just to touch on melatonin, this is how important test, assess, don't guess is. You have to test, because for you, melatonin 0.25 was right. For some people, I put melatonin up to like 30 milligrams, even
Mhm.
like 300 milligrams for some cancer patients when they're going through
Oh,
radiation therapy,
yes.
right? So the melatonin dosing varies from 0.25 to 300.
Yep.
How do you know that as a lay person without testing, right? So that
And have you read, just we keep going on these sidebars, Jan, but there's some studies about the suppression of the growth of cancers with
yeah,
melatonin.
totally. So I'm a big fan of melatonin. I love it.
Totally.
I typically use about 3 milligrams,
Yeah.
but for sensitive people who wake up groggy, microdosing is great.
Yeah. Yeah.
So use other things with it to sort of make it synergistic in smaller dosing. And I'm happy to go into Dutch test if we have the time for it. That's
Well,
another.
you know what? We should touch on it because Don't you think some of these sex hormones can affect those neurotransmitters?
Of course, they're all
Right?
interrelated. We didn't even touch on the GI part of it, but
Oh, yeah. Geez, we
but
could talk forever.
yeah, but I do often tell my patients, I don't know if you guys have teenage boys who plays video games all the time, but if you look at them playing game, they all have lives, right? And with every insult, every attack, their life gets smaller until they're dead, right? So
Yeah.
we also have those living juices that makes us alive. One of the big living juices is our digestive enzymes. That decreases with aging. It just does. That's why we don't absorb the micronutrient we need and the blocks that we need to make our hormone, right? Two, obviously, is our sex hormones. So like when we were babies, we didn't know if it was a boy or a girl by just looking at it, unless you had a pink ribbon or a blue
Yeah.
clothes, right? Because they lack the sex hormones. And then if you go to a nursing home and you see people sitting on the bench from the back, you're not sure if that's a female or a male. Again,
True.
they have lost their sex hormones. So our sex hormones keep us alive and active, right? And then the third one is the brain neurotransmitter. So digestive enzyme, hormones, and brain neurotransmitters are basically our living juices. So going back to the sex hormone, which is so important, Dutch test, which is a dried urine test that looks at your metabolites. Now, there's a couple of ways, just to wind back a little bit, there's a couple of ways to test your hormones. It could be serum. If you just have a conventional medicine family doc or internist or GYN, don't be afraid to check it just in serum, because it is a representation of your hormone. It's not that accurate, and it's only a glimpse because our sex hormones are oily and our serum is watery. So it's not always that accurate, but it is one way, cheap, easy way to look at our hormone
Totally.
titer. So go for it, right? The next one, there's CRTs that does saliva, and then there's dried urine one that looks at metabolites.
DRT labs, right?
Yeah,
Yeah.
CRT labs does saliva with the cortisol and everything,
Yeah.
and Dutch does metabolites. So saliva is a little bit more accurate because it's oil-based, so it's a little bit more accurate representation of your hormones to be checked. And Dutch test we love because it's a metabolite test, and by looking at the metabolite, we can kind of sort of guess what your risk factor of your breast cancer might be. Because
Mm.
estrogen metabolites, if you use a lot of 2-hydroxy pathways, it's protective. If you use a lot of 4-hydroxy or 16-hydroxy, you're more likely to have breast cancer because you're not detoxifying all this estrogen. So it's about the balance. You want your estrogen to be there, but not too much. And you want to be able to detoxify from your estrogen.
Yeah. I mean, geez, we started talking about metabolic syndrome and ended off with the Dutch test. There's so much, you guys, there's so much involved in our metabolic health as we age. And, we could even go into some of the protective things, I'm sure. Like, I'm a big believer that any midlife woman should be on like a sulforaphane. That's just
Yeah.
my,
Or
it's
just eat a lot of like cruciferous
Yeah,
vegetables.
if you can eat that much broccoli, I mean, every time I make it, my husband cringes. So, there's some challenges in my family with that. But so much information in this episode to really help you get started and understand that your metabolic health is really going to be this is totally my opinion, one of the most important factors in how you're going to age.
Totally. Yeah, I agree. Most
Yeah.
definitely. When we created that SeeBeyond shop website, we did it in a way that you could just go in there and put your problem in there, and it will give you a supplement list of stuff that you can take to start off with. If
That's
you're far
amazing.
away and it's really hard for you to get to a functional medicine practitioner, whatever the reasons are, you could just sort of like put in your problem there and get a glimpse of these are the nutrients I need, and
Oh,
feel free
that's
to use it.
beautiful.
And there's lots of blogs on how to sleep well, how to eat well, and all of that. So utilize it. It's a resource for you.
That's so amazing. Okay, Dr. Lee, tell us, where can we find you? Your
Where
socials, like what are your handles?
So we're based out of New York, but we're out of Scarsdale, New York. We have a satellite in Greenwich, Connecticut, and we have patients all over. We do a lot of telemedicine. During COVID, we learned that we could essentially see anyone from anywhere, right? 'Cause when during the shutdown, nobody was coming in, but we were pretty successful in doing telemedicine and shipping out test kits to you. And we were pretty successful in giving you guys the supplements that you needed when we got the results back.
Beautiful.
Test, assess, and don't guess. You need that testing to kind of do it right. But if you don't want, you're not ready to test, then be my guest. Go to SeeBeyondShop.com. I named my practice SeeBeyond because I wanted people to see beyond their current status, whatever that is, their medical diagnosis, their age, their weight, their race, whatever that is. I wanted to give people hope. I wanted people to be seen for who they are. I wanted people to be heard. And I also wanted to see them through their journey where they come out successful. So
Oh.
our SeeBeyond shop is definitely designed for people to sort of like go in there, figure out what they need, cheat, take whatever you need to take from me. I'm here to help. Like my whole purpose in life is to help people. And I really stand by that. So whether it's podcast or website or whatever it may be, I exist to help. And so take it from me.
Beautiful. I would align with you actually on that. So thank you so much for coming today. This has been an amazing conversation.
Great. I enjoyed it, Sandy. It was really good.
Okay, I hit stop on the audio.
Great.
Hold on one second.